program, specifically for advanced standing students. And I'm also advising the joint degree students who will be in the joint degree program. So I'm happy to meet you all and look forward to working with you as well.
Hi everyone, my name is Naila Burks and I advise students that are in the core program. So students that did not receive their bachelor's degree in social work or their bachelor's degree is more than 5 years old. So with those students, I am your advisor. And a little bit of background about me. I received my bachelor's and master's degree in social work and worked in the child welfare field for a couple of years before transitioning into higher education.
Thank you. Thank you very much. Our two students, please introduce yourself, Julie.
Hi, everyone. My name's Julie. I'm finishing up my final semester in the dual degree program.
My name's Peyton. I'm same boat as Julie. I'm finishing up my program and graduating in May or April, I guess.
And I see we have Dr. Najer Durak on here, and if you would like to introduce yourself also.
Sure, I'll be quick. Good afternoon, everyone, and happy to have you guys here. I'm Anwar Najer Durak. I'm the Assistant Dean for Student Affairs and would be involved in your application in some format if you're applying to either MSW or MSW MPH program. So welcome again.
Thank you. And Dr. Love Shropshire.
Hi, I'm Dr. Norma, and I'm a lecturer in the BSW and MSW program, and I am also the BSW program director. Nice to meet everyone.
Well, I would have said Dr. Norma. That would have been easier for me.
Yes, that's what we're doing now, Dr. Norma.
Great. Well, thank you. I am so excited that we have a number of students who are interested in the MSW MPH joint degree program. I'm so happy that you've attended this session, and I hope that you might be thinking about submitting an application for the MSW MPH joint degree program. This is a time when this has really become an area of interest for so many students, given the pandemic, the inequities we see in health that have been illuminated by the pandemic, and also the Black Lives Matter movement and the social injustices that we have seen across all areas and all institutions in our society. So this is a ripe time to apply, and so I'm pleased to see so many students interested, and I've had a lot of students contacting me that were interested. So I want to give you an overview of the program so that you have some idea about it, and then just open it up for questions. And I hope to do this within like about 7 minutes. So let's see if I can go through this pretty quickly. I'm going to do a screen share here. Does everybody see that? Just give a thumbs up if you see the, okay, great. So what is public health social work? This is an area of social work, a sub area. It utilizes social work theories and frameworks and research to promote health equity. And it is focused on population health primarily and plays a very big role in meeting the needs of underserved and vulnerable communities, which is very much what we see in social work. So there's a lot of overlap, and there's a lot of historical overlap between public health and social work. So the MSW MPH joint degree is where one studies the knowledge, theories, approaches, and methods of both professions, earning their MSW and their MPH degrees simultaneously. And simultaneously is quite important because as I talk a little bit more, you'll see that it's really important to be able to double count credits, which makes this a more efficient degree. So it's transdisciplinary, really important facet of the MSW MPH joint degree program, that it's utilizing multi-disciplines that collaborate to eliminate the health inequities. It addresses prevention as well as health promotion and uses epidemiological methods to really dig into those social determinants of health that are causing so many problems for our vulnerable populations. So what are some of the strengths? One is that we get a lot of really passionate, diverse, mission-driven students in this program. Students can earn, of course, it's cost efficient, earning 2 degrees in a shorter period of time with fewer credits. Our graduates of these kinds of programs across the country, of which there are about 52, they report high degrees of career satisfaction and are employed in a lot of diverse arenas. It's good for public health, it's good for social work, and it's good for public health. It's good for social work because it connects us as social workers with public health methods that can help us to really reach sort of that public health need. And it's also good for public health because it strengthens public health's connection to social justice and unmet social need. And it promotes this interdisciplinary collaboration. You should, if you're getting 2 degrees, I think there should be a commensurate salary. And by looking at some of the US Department of Labor occupational handbook, you can see that there is about a $7,000 difference in salaries projected in the healthcare social work area, which is more inclusive of just public health social work. There's also the projections through 2026 that the healthcare social work field there will be an increase in jobs over that period of time. I'm gonna just keep going to kind of get through this. Some of the positions for MSW MPH graduates are policy analyst, program planner, program director, researcher, evaluation specialist, disaster response leaders. I have had about 3 or 4 of these positions post MSW, working in health departments. And the work that I did post MSW as an MSW, yet not an MPH, but working within those sectors was fantastic. It was really a great opportunity for me, and then led to me going back and getting my PhD. Employment opportunities, these are only a small set of them in the Detroit metropolitan area. Of course, there are many employment opportunities across the country. So what are the requirements? What do you have to do to get the MSW MPH degree? There are 60 credits for the MSW. If you come in as a core student, that would be a student coming in that doesn't have a bachelor in social work. So 60 credits. If you are a student coming in with a bachelor degree in social work, it's 28 credits. The Master in Public Health is 42 credits, and it breaks up, as you can see, into foundation, concentration, applied learning, and electives, similar to, I didn't actually say that, but the same thing in the School of Social Work. You have foundation courses, you have concentration courses, field work, and elective courses. And then the 42 credits in public health. If you add those together for course students, it's 102 credits. But by combining the public health and the social work together and applying, getting into the MSW MPH program, it is about 85, I would say anywhere between 83 and 89 credits. So it depends on your whether you pick ICPL or interpersonal practice, micro, macro, whether you come in as a advanced standing or a course student. So I just want to put the sample here. There are some changes to the curriculum. So this is just really to give you a sense of what you would be doing over the 3 years. It's a 3-year program for those who have do not have a BSW. This is for course students. And it requires that you are attending courses during the summer. not necessarily a full load of courses or a full set of courses, but at least 6 credit hours during 2 summers in order to accomplish and complete the MSW MPH in 3 years. The application process, we say start early by October 1st. That date has passed, as we know. But the deadline for the core students is the 1st of April, and for advanced standing students, it's March 1st, because advanced standing students would be applying for the summer, since advanced standing students actually start their bridge courses in the summer before the fall. The 2 students who are going to be sharing some of their experiences here are graduating in the fall. They will be number 2 and number 3 of graduates of this program. Our first graduate was David Sakala, and I just wanted to share this slide before Peyton and Julie have a chance to tell us about their experience and answer some questions that we have for them. You know, David said he knew he wanted to work in public health, that he wanted to develop social work skills to address health issues and disparities. And it really made him think about public health through a different lens. And he is now working at Henry Ford Health Systems in Detroit. He was able to get a position there actually, think about a month before he graduated. Right, stop this share. And what I'd like to do is open it up to asking some questions of our panelists. So the Q2 questions that I'm going to ask. So why don't I start by asking Peyton why or what made you choose a joint degree in social work and public health? What was your interest and your reason?
Sure. I was really interested in the collaboration between the 2 fields. I had an initial interest in social work. I minored in it in undergrad, but I felt like there were ways to integrate the degree into other areas of my interest, such as public health. It was new to me. I was in a science background coming into the program, but I thought it was a good challenge, and I just really saw a good overlap between the 2 programs. And it was such a new program when I came in. The novelty of it was really interesting to me because I had the opportunity to shape the program and mold the experience to really how it fit my needs. And now, obviously, with COVID, it's the perfect time to get a degree like this.
Sure. Julie, what made you go into public health and social work?
So interesting enough, talking to you, Dr. Jaffe, on the phone was actually the reason I went into the dual program to begin with. So I wanted to just go for public health because I was working at Carmanos at the time and was witnessing a lot of health inequalities that was going on, especially I was working in the floor and in the clinic. And there was a lot of issues with like social and economic and some environmental factors. But my view of social work was this view of like school social workers or therapists, and didn't have an understanding that social workers also can do, program development, and policy making. And after talking to Dr. Jaffe and learning more about this dual degree, I learned that like I can combine 2 skills together to have a social perspective as well as a scientific perspective to really change the way that we look at health.
Thank you. I'm really glad to hear exactly why you decided to get the MSW MPH. I'm not sure I ever asked either of you that specific question. So was there another question I think would be interesting for the students is what in the coursework, what was maybe a course or 2 that really opened your eyes or had an impact and will continue to impact you through your professional development?
I can go first. So when I saw this question, I thought it was interesting because initially I thought I was going into the social work field with the background in public health through this joint degree. But now that I'm at the end of the program, I'm more looking towards public health jobs and policy, healthcare policy specifically. So the one course that stuck out for me, it was one of my favorites. It was the first year it was in the program. It was Social Work 70 or 7720, which was Introduction to Social Welfare Policy. And it really sparked my interest in policy and the macro track because I was able to see how the joint degree would be able to like applied in real life practice. And then obviously also the field placements, they're the best training for jobs in the future for your career. My field placement right now is training me in what I want to do. It's with Henry Ford Health Policy Center. So it's been really impactful in my career development because I'm doing hands-on work that I would do outside of this schooling program.
Thank you. That's actually some place where I would have liked to have worked back in the day when I was an MSW student.
Yeah, fingers crossed I get a position there.
Julie.
So a newer course that they introduced this year was the healthcare policy class. So that was one of my favorite courses just because you really get to the nitty and gritty of like how our healthcare system operates and understanding how policy works. And for me, that was very essential because unless you are a policy, you went and got your undergrad in public policy or whatever, or any of those types of degrees, you don't understand all of the ins and outs of what goes into policy making. And then another class that I really found beneficial was the social action research and evaluation course. And that's an area that I personally would very much like to get more into. So what it does is it's combining action as well as research at the same time, hence the name. And you're really using community and community organizing to develop programs and research to make change. And I've learned from that class that if you don't get the community involved, nothing will happen. Because if the community doesn't want that research and doesn't want that change, like you could put it in their community, but they won't follow through with it.
That's great. And I'm glad that you're both bringing out some of the courses in the School of Social Work as well as a public health course. The health policy course was in public health, and that's a new course for them. And the social welfare policy course that Peyton, you mentioned, the 7720 course, is actually one that can be used as an elective, so it can be double counted, as well as that other health policy course that you mentioned, Julie. So thank you. What do you see as particularly beneficial to getting both these degrees rather than just an MSW? I have students ask me this often, what's the difference? Like if I get just an MSW or just an MPH, what's the value of the two degrees?
For me, I personally saw it as a way to open more doors and offer more opportunities for career advancement through the dual degree. I came into the program, like I said before, thinking I wanted to do macro social work, but I've changed my goals and my priorities to now healthcare policy. And I would have been able to get into the field with just a social work degree because my field placement is through the social work program. But with the public health courses and background, it's really pushed my working knowledge towards public health. And I feel like I'm going to be more prepared and qualified in the field. And it just, really opens more doors and opportunities and shows you different avenues that you can achieve work that you want to do in the future with your career.
I found that getting training from both a preventative and interventional aspect helps to translate community-based work. And this will allow me to assist in like development of policies and prevention at not only at a community level, but at a national and broader level as well.
Great, thank you. Is there anything else either of you want to share with students who are thinking about going into this area and actually putting in that extra year and a couple summers to get an MSW MPH degree that you think would be helpful if they're kind of on the fence and maybe they're not sure?
Yeah, I can go.
Okay.
I would just say go for it. It's one extra year if you have the financial and time ability to do it. There's no harm in doing it. And if you go down a public health or social work track, the background that you have in either of those courses or programs will push you forward and give you more experience. So for me, going into a public health track, I have the background of now social work, so I can keep my lens on social determinants of health and how to best serve the underserved communities within Detroit specifically. And I just think it's really beneficial. It gives you more knowledge on things that you may not get from only one degree.
I would agree with Peyton on that. And then I would also like to add that as you go through the dual degree program, you'll like slowly notice that your knowledge base by doing both programs and getting both perspectives, not only the public health, but also the social work, puts you a step further than your colleagues that are within that program. And like, for instance, being in some of my public health classes, I brought in a social work perspective that some of my colleagues didn't even realize or try to think about. And it broadened their ability by me just being there and bringing that perspective in.
Great. Thank you very much, both of you. I'm very excited that you're graduating in May and excited for your future and professional life. I did want to just share one slide that I had skipped that has some thoughts by other people who had graduated with dual degrees and their perspective on that. So let me just put this, let's see if I can get this just from the current slide up here for you. So move this over. Do you see that? The thoughts from dual degree MSW, MPH joint degree students. These are students across the US at some other schools that have been around longer than Wayne State's. And I think it's important to just take a look at this. A dual degree program is a wonderful opportunity to learn and apply skills and knowledge from both fields of public health, fields of social work. This person felt better equipped to address public health and social issues. And I particularly I won't read all of these, but the one on the bottom was really focused on macro, community management, and policy practice. And I know that both Peyton and Julie are macro social work. They chose the concentration of innovation in community policy and leadership. But we have probably half our students right now in the MSW MPH joint degree program who have chosen interpersonal practice. And that is in a really unique area because even though their focus is going to be more on interpersonal practice rather than sort of macro practice, they are also doing things from a population perspective when they're taking their public health courses, which really broadens their approaches. So they can work in a clinic and they can do motivational interviewing with people around diabetes or around obesity or around substance abuse, or doing therapy with mental health within clinics that might have a broader population health focus where they can get involved in both community assessment as well as micro. So it really broadens what they can do in those venues. So while often people think about the MSW MPH as built more for the macro concentration, it has a place in interpersonal practice as well. So now I think is a time to just open it up to all students. I'm going to stop sharing here. Any questions from any of our students, or would you like to identify yourself? Here's a question, so you can put things in the chat. Certainly I'd be happy to answer. How does the length of the program curriculum change if you have a BSW and can go in the advanced standing macro? The length of the program is 1 extra year and 1 extra summer. So as an advanced standing student, you would go 2 years and you'd start in the summer. Let's say you applied this year. You would start in the summer of 2021 and you would go through 21, 22, and then the summer of 2022, and then graduate in 2023. 2-year program. If anybody wants to speak or ask a question or say who you are and what your interest is in the program, that'd be fine too.
Hi, can you
Hi,
hear me?
Amelia.
Hi, how are you? So I'm interested in the program. I am a graduate from Wayne. I graduated with my MSW, Advanced Standing in Interpersonal Practice, in 2006. And at the time, one of my friends was going to Tulane, so she has an MPH and MSW from then. So I am interested in it. I'm just wondering, are there tap-up options? I hate to call it a tap-up, but if you already have your MSW and you're interested in doing an MPH, is there a version now that would accept the credits that we previously had?
You know, that is an excellent question, Amelia. And I wish I could say, yes, there is such a thing. But once you have obtained the degree, you can't use those credits again for another degree. It has to, in this program in particular, it has to be done simultaneously. I will say that the MPH program does have a certificate, and that there may be opportunities to get the certificate and feel like you've had a good grounding and be able to use that for employment also.
Yeah, I did see that. I think there were certain financial criterion too related to what you could apply for financial aid wise for the certificate, and also that you wouldn't have an MPH. But I thought it was a bit of a stretch, but I thought I would ask. Is there a person that you could put us in contact with for those of us that are interested in adding versus doing the dual MPH, that we could talk to about those other options and financial options as well?
Sure. Alyssa Firestone is the person that I would refer you to in the public health and in the it's the School of Medicine. It's the Department of Family Medicine and Public Health that she resides in, and she's a program manager of the MPH program.
Okay.
Thank you, Peyton. Peyton just put that her name in the chat box.
Wonderful. Thank you.
Sure.
Hi, I'm Miglina. I'm not sure if you can hear me.
I can. Yes, Miglina. Nice to hear your voice.
Thank you. So I just graduated from Wayne with a bachelor's in public health, and I also did my minor in community health. So I do have a little bit more of a focus on just the micro work that community health does and the organizing that is in community health. And so I guess I have two different questions. First is, for this joint degree, are there any specific financial options that are available for students that need the financial help?
Well, I will ask the advisors, Lawrence Robinson or Naila Burks, if they want to answer that question, because I'm knowledgeable about the financial aid.
Yes. So here at the School of Social Work, we have private scholarships. We have 30 plus private scholarships that you can apply for, as well as we have the graduate professional scholarship through the grad school and the master's scholarships through the grad school that we can assist you or direct you into applying to. And I can send that information or put that information. I'll send it to you in a chat, in a follow-up email as well.
All right, thank you. And then my other question was for the students, and if it was there anything that was surprising to you during the program, or something that you hadn't known when you started the joint degree?
I guess not surprising, but since it was such a new degree, the schedule of the classes changed a lot while I was going through it. So just rearranged the timing of when I would take certain classes. And I was also able to talk in depth with all of my advisors and make the schedule work best for me. Since it was moving a lot, I was able to rearrange where needed. Nothing really surprising, but it was helpful to have my advisors very open and honest about the program and the timeline.
I would say almost exactly what Peyton said. I had a rough start into the program because I had issued, because when you're applying to the program, you have to apply to both schools separately and then get accepted into both schools separately unless that's changed.
Yes, that has changed. It's a one. Yes, you were very early, Julie.
So when I started, you had to apply to both schools separately, get into both schools separately. And like one school, at first there was lack of communication, I think, between the two schools, but I think as the program has developed, so that originally was very surprising to me because I didn't realize that lack of communication existed. But as the program has developed over the last 3 years, I think there's been a very strong change, and now we have a strong communication between the two programs.
That is actually an issue across the country with MSW MPH programs, because we're siloed in many ways in our disciplines, and sometimes it's hard to collaborate and really meld two degrees together. So we've worked very hard to try and do that over the last 3 years, and I think we've been pretty successful. I think that everyone should know that you have one application, and it's for the MSW MPH joint degree if you were applying for this rather than just the MSW or just the MPH. So it is a separate degree program. You don't apply separately. It's one application. And that application, once it is submitted, it goes through a review process in the Department of Family Medicine and Public Health submission first, and then it goes through the School of Social Work submission committee second. And each one has their own requirements. They're similar, but the MPH program has required the graduate record exam, which no one wants to take. And this is the best time to apply because right now it's being waived because of the pandemic. So that's an advantage to applying this year.
I will add one more surprising thing, I guess. When you apply for courses, a lot of times you need overrides from one or both of your advisors, just because if it's going through like school social work or the School of Medicine, I've needed overrides for almost all of my classes. And just don't stress when you see that you're not eligible to apply or to register for a class. Just email your advisors and they'll give you an override. So it's totally fine.
We're hoping we're working, we've worked out some of those bugs. I do remember that, Peyton. I remember a lot of emails around that. So I think we've gotten better at that and better at both advisors in public health and social work. And Alyssa Firestone really reviewing ahead of time and making those alterations before you actually get the whatever you get when you go to register and you can't. So this is covering a lot, and anyone who has a question or wants to ask.
Hi, I had a question.
Sure, Dina.
My name is Dina. My name is Dina Abdullah. I graduated with my bachelor's in public health and a double minor, one in community health and global health and social medicine. So I took this opportunity. I was actually so happy to see this degree. I'm not going to go on a rant. I'm going to make it quick, but I was so happy when I seen this degree because I started working as a caseworker. So I'm doing like social work at work. And then I was like, wow, this is like something I see myself doing. I'm really interested in it. So I did my research and I found this degree and I was so happy. Sorry, I just came up a flight of stairs and I'm out of breath.
No worries.
The pandemic has really put me out of shape.
I know.
So what is the census like, the student census? Like, do I have to worry about like registering for a class, but then there's not enough seats for it? Like, how does the census look for this program?
Well, that's interesting. We haven't had much trouble with students getting into the classes that they need to take. Occasionally, there have been issues, but over time, I think we've resolved a lot of those. Peyton just brought up some of them that she encountered early on. But again, I think in terms of, you're talking about the census in the classroom, like it being full and you're trying to register, you can't. If students have to take that course because it's a prereq for another course and it's part of their plan of work, we make sure that they get that course, except in very rare circumstances.
I think to add to what Dr. Jaffe said, I've in my 3 years only had one issue getting into any of my courses. That was a requirement, and it was because I needed an override, and like the email exchange was just not going fast enough, and they just admitted me. So because they knew it was one of my prerequisites that needed to get done.
Yeah, I've never had any issues actually getting into a class. It's never been full or anything like that. So my issue was just clerical administration issues.
Yeah. Dina, your background sounds very appropriate for the MSW MPH joint degree if you're interested in that social justice or clinical practice piece.
Yeah, absolutely. I've already applied. I sent my application, so I hope I get accepted.
Great. Good to hear. So we have to leave sort of have a pause so that people can sort of think, is there some question I really want to ask? Well, if all the questions have been asked, you can easily send me, I'll put my, my email address in the chat. And feel free to contact me and I will respond quickly. Thank you very much for coming, and I appreciate it. Jason, if you and Julie and Peyton can hang on for a few minutes.